Oh, how fabulous. Hello, and welcome to How Fabulous by Toni and Co. I'm Toni, and in today's episode, I have a chat to the very fabulous Malinda Micich. I never get a name right. We go into that. I keep trying and I just don't quite get it. But she forgives me. Now, Malinda is a nurse, so she's a lifesaver, but she also has her own business doing botox and fillers to those who need it for cosmetic reasons, not for migraines and things like that. And she just goes into the hows and whys and whats, and it's really fascinating. And I love the way and how she started her life out, why she wanted to be a caregiver. So there's all of that. We go into everything. She's a lovely lady, and I've thoroughly enjoyed having a chat to her in this episode. So I hope you enjoy it. Malinda. Hello and welcome to How Fabulous by Toni and Co. I'm Toni, and today my fabulous guest is Malinda Micich.
Fantastic.
And some of you may recognise that surname as being Croatian. Welcome, Malinda.
Thank you very much for having me.
Did you like that introduction? I mean, I don't know if I need to mention the fact that you were Croatian, but I just
the
love
name
it.
pretty much says it all. Micich.
Micich. I always thought it was Malic.
Oh,
I don't know how I had that in my brain. But anyway, it's not. I stand corrected. For the info.
Malinda Micich.
Micich. Anyway, so welcome. Thank you so much for being here. We don't know each other that well, but we did meet through me being one of your clients, and we'll go into that. Mm-hmm. But I love that you're here today, and that when I rang you, you said, "Yeah, of course, I will come. It will be fantastic." And
I was out walking with a girlfriend and got the call. I thought, yeah, why not?
Why not? Just do it.
I'm honoured to be asked. Yeah, thank you.
Oh, excellent. Well, it's all about that. I mean, How Fabulous is all about these fabulous people that I, get to meet through different areas of my life, not just through work, but through work and play and life and being a mum.
Yeah.
And you were one of those fabulous people.
Oh, thank you.
And you've always been such a lovely champion of me and the work I do as well, which is just delightful.
Because you're very spectacular yourself, fabulous yourself.
Oh my gosh.
I must say so, yeah.
No. Anyway, so back to you. So we met a little while ago, and in fact, you are the lady that has fixed my very deep frown line that I had right there. It looked like someone had, in fact, not even someone, a giant, had come along with their big giant nail and gone right there in my forest. I think it was a very deep frown line that had been building up over years and years. And you went, oh, just put a little bit of botox in there.
Just zhuzh it a little bit.
Just zhuzh it there. Yeah. And then the next thing, there was no line there, which is fabulous. So that's how we met.
It's fabulously miraculous.
It is fabulously miraculous. So what is your official... what do you call yourself? Are you a beautician or a Botox artist?
Predominantly I'm a nurse, so I do Botox and fillers, and therefore to do the procedure you need to be a registered nurse or a medical practitioner. So I'm a cosmetic nurse injector.
A cosmetic nurse injector. And so, but I mean, this industry is when I say this industry, I'm talking about the beauty industry. There of course are people that maybe call themselves cosmetic nurse injectors, but maybe are not nurses?
No, you have to be a nurse because it's a Schedule 4 drug. So therefore you're unable to administer the drug without a prescription from a doctor that then enables a nurse to be able to perform the procedure.
But what about... okay, so what about when people go to Bali or Thailand and they get some
Bali,
Botox?
I'm uncertain what their laws and regulations are for there, but in Australia you have to be a registered nurse, therefore doing the course to be a registered nurse, or a medical practitioner, so therefore you don't need to work under someone else. If you're the medical practitioner, you can provide your own prescription. So a registered nurse then works under a doctor, a prescribing doctor, that he authorises the script that enables you to be covered to legally administer the drug.
And you called it a Schedule 4?
Scheduled 4,
Schedule 4.
yeah, which is a type of drug that requires a prescription. So you can't buy the drug at the chemist over the counter. You need a prescription, and an authorised prescription, because it is Botox. So therefore it's...
And for those that don't know what actually Botox is, tell us what is Botox.
So Botox is a muscle relaxant, so it stops, freezes, paralyses, whichever word you feel comfortable using, the muscle. And therefore the skin can't fold because the muscle can't move.
Okay, that sounds really a very simple
so it is.
explanation.
Yeah. So if you stop, paralyse, freeze the muscle can't move. Therefore the overlying skin can't fold, crease or wrinkle. So therefore the appearance of the skin is made significantly better. So it's not treating the wrinkles that we see, the fine lines. So having an understanding, you need to know
lots of those.
So we all. So you need to understand how it works, and then you understand then when it wears off, the effect that you've had.
So when you can actually frown like this, that means it's no longer
Therefore
around.
it's wearing off, and therefore the dose is dependent on the amount of movement that you have. So if you have a little bit of movement, it's wearing off, or you don't have a strong muscle group, then you just need a small dose.
Well, there you go, for all those people that just don't know about it. And look, to be honest, I didn't know, I mean, so say for example, 20, 30, 40-year-olds now, everybody knows about Botox. Everybody knows about filler, and there's all these, fabulous things that are coming in and out, and this is the next thing. But when I was 20, I had no clue. Like, I don't even think that was a thing. Did you know about it? Like, what were you doing when you were 20?
Well, I'm 50, so I started having it done
We're
when
the same age, and we're going to go into about our 50th, what we need to be doing. Yes.
So I started having it done just over 20 years ago, when it was just starting to branch out in Melbourne. To have Botox and fillers done. But at that time,
so I don't even think I knew when I was 30 what it was. No.
But then I've done plastics in Melbourne for the last 21, 22 years. So at that time it was only being performed at plastic surgeons' rooms. So now with time it's become more commonplace, and a lot of clinics are offering it as a service. So it's no longer exclusive to plastic surgeons' rooms.
Yeah, and I think, isn't it interesting? I'd love to understand and go back to how you started. Well, you obviously didn't start doing, you are still a nurse, so you got into caretaking of people, and I'd like to understand how you started that. But just talking on this idea of how, I guess, common and how mainstream and how casually people talk about getting Botox and where you can get it, and you can have Botox parties, and you can go to a shopping centre and get Botox, and whereas even 20 years ago that wasn't a thing. I mean, what's your take on how that whole kind of idea of what it is and who can have it and how it can be accessible to you, how that's changed over the years?
It's changed. As I've said, starting out, it was only done at plastic surgeons' rooms.
Yeah, and so that was it a lot more expensive? Because if you're going to a plastic surgeon,
because their overheads are much greater to work, in a plastic surgeon's rooms, hiring the rooms and paying for the facilities there. So therefore, to carry the overheads of that, it was a lot more expensive.
So it was more of an exclusive service, only for
that's true. For those that could afford it, or whether more people would have it done, but they were having a greater, significantly smaller dose done, so they weren't having as much or as many areas treated, because for the expense of it, for their budget, they were choosing to only have one area done. Then with time, as it became more cost effective with more people in the market, then they were offering packages, etc. So therefore people can have a greater dose for less money spent, which made it nicer for people.
And when do you think it moved into shopping centres? I mean, was that a really relative thing?
In Melbourne it happened about 7 years ago or so.
Really?
Yeah. So laser clinics, which I used to work for them predominantly, they came out to Victoria about 7 years ago, that's my understanding. And then I think they now have about 140 stores across Australia, New Zealand and the UK. So they've changed the business model a lot.
They have.
Made it accessible.
It's hugely different. And you're right, and accessible to and accessible to younger people. Do you find that people are coming to you that are younger getting it done instead of older people like me going, oh, it's already happened,
Potentially.
what should we do?
And then there's that mindset, do you need to have it done as prevention, which I don't follow that philosophy. I feel it's a little bit like dyeing your hair before you go grey.
I feel like that too. I feel like
so having it done when you don't need it, as we touched on, the dose is dependent upon the amount of movement you have. So if you're young and beautiful, you don't need to have it done. If you want to, you know, embrace your youth and feel beautiful and enjoy being young.
And that's a little bit of a thing as well, you know, as you get older, you and I are both 50, nearly 50, and looking back, do you look back at your photographs when you were 20 or when you were, you know, even 30, and I remember thinking, oh, you know, you pick it apart and go, not that, not that, not that, and actually, you know, there was no fat on us, and you know, we were living at my whole kind of mindset was so different, and yet the idea of who I was at that time, it kind of maybe wasn't as good enough, but really I wish my 50-year-old self could say, you know what, shut up. Your legs are okay. You wait till you get bloody age spots and, you know, grey hair and things like that. Appreciate what you've got.
The here and now is so important.
It is. I really feel that my mindset is changing a great deal.
But I'm wondering too, when we turn 60, so the next decade that happens, then we'll almost look back and think, wow, how great did we look in this interview today?
I know.
Is that just me or you?
Yeah, I feel like that'll be the same thing, you know, and even 40, you know, and 30, but definitely 20. But I think when I was 20, I don't know about you, you know, there was a lot more there wasn't the mortgages going on, and there wasn't the children and that sort of thing.
True.
You had such a different focus on what was important. You know, going out so much more.
Socialising with girlfriends. Getting your career established.
That's right, and working out. And so going on to that then, so did you study at school? Like, so what did you
do? Nursing
what did you do?
So I left school, got into ACU to do nursing.
So how did you know that it was nursing you wanted to do though?
Oh, see, I came from a small little country town in Ballarat where effectively a lot of the girls, you chose teaching or nursing. That's what I felt. The careers advice was limited back then, and then I really think I like the idea of caring for people, which I still do. So I'm very happy with what I've chosen to do. But then when I went back and did nursing, I was one of the first ones to go through ACU in Ballarat. So there was no one ahead of us. So we were the guinea pigs going through. So there was no one in, when I was in first year, there was no one in
ACU?
Oh, Australian Catholic University.
Yeah, right.
Yeah.
And so you did nursing at the uni?
There. So now there's one in Melbourne as well.
Right.
But when I was doing it, there was no one ahead of us. So when I was in first year, there was no one in second and third year.
So who was teaching you? Who were the people that were teaching you?
Good questions. So then you look back and they were nurses that had just left the hospital training system, that had been working in hospitals, that then had changed their mindset to teach us
in the hospital and wanted to then teach. And how did you find that? Did you? Do you think you benefited from them having the experience in the hospital?
Yes and no. So I feel we were looked down upon. They didn't like us coming through. At that stage, we were coming out with a diploma, not a degree. And then we had to go and change the course to then have a degree at the end of it and upskill ourselves. So the course was 3 years. So whether you were trained full-time, whether you were trained in the hospital system, whether you were trained through now this university system that I, by chance, bought into because of the time frame. So then the 3 years you graduated, but then the nurses that were in the hospital system, and I can now see how they felt, they were thinking we were going to come out more experienced than they were, which wasn't true. It's all about, I suppose, fear of the unknown. Whereas now we know it's all the same. We're all the same.
All the same in what sense? That
we were nurses graduating wanting to care for patients. So we didn't come out upskilled when we were seen for job opportunities, having trained through the university or trained in a hospital. It was on par. We're the same as everybody else.
And do you think that a nurse, and I'm talking about different from a doctor, do you think a nurse that
that is working in a hospital is only as good as, so say they get a top mark, and I don't exactly know how it works, but let's say they get a top mark and they go into that hospital and they start caring for patients. The person that gets a lesser mark but still gets in to go to that hospital, and they are more of a, do you think people can be more suited? You know, can one nurse, because of her demeanour and because of her, even though one's got a higher mark.
And that's what's great. So you come out with this disparity of our own personalities, and nursing's a great career. I'm not sure what to liken it to, but so therefore if you like caring for people and you've got a great, maybe your mark's not so high, then you go into a career where you can do, I don't know, paediatrics, geriatrics, oncology, and care for people that need someone to care for them. And then maybe if you're more academic, so then you'd go and become potentially a director of nursing, which I've done in the past, become an auditor of hospitals, work within, within an industry where they need a nurse on site at buildings and factories and what other job sites there are. So nursing's great, so you can end up working in different areas that suit your personality. So there's not a typecast nurse, I don't think.
Yeah, right. So that's interesting to pick up on, because I don't imagine that there are, or wouldn't have thought about the fact that there are nurses on building sites. I mean, we used to always have a nurse or a first aider, but I used to use a lot of the nurses on shoots, because we always have to have first aid. So we would have nurses that would come and, especially for kids' shoots,
So there was a nurse on site for that?
Correct, and in particular with when we would do like Country Road or Bonds or kids' baby shoots, they preferred not to just have a first aider, they actually preferred to have a nurse. And it depends if the baby was younger than, gosh, I can't even remember, it was really like less than 6 months. They had to have a proper baby nurse.
Yeah, like a paediatric
nurse.
Paediatric
nurse, as well as the mother, of course. But yeah, so there was that whole thing. So, but I've never actually heard of a nurse being,
so when I was
on a building site
doing, or maybe not so much a building site, within a factory, there was a nurse that was doing safety checks and educating them for back care and first aid if they injured themselves with the machinery on site.
Yeah, right.
So she was there doing that, which seemed like an interesting job, but that's outside the hospital setting.
Yeah. And what's it? So you've worked in a hospital as well. So you left school and you went, I'm definitely going to be taking care of people. So you go through that system, you get trained some more.
Yeah.
Then you go on to the next stage. So you did
did 3 years of nursing, came out with a diploma
instead of a degree,
because it didn't exist at the time, because we're all making it up as we're going along. And then finished with the diploma, then was working within the hospital in Ballarat, and then chose to go and work in an operating theatre, so the theatre setting, which was great.
Wow.
So I sat an interview with 5 people on a panel thinking I'm not going to get in. So I sat the exam, sat through the interview with 5 on the board, got through, and then spent 12 months doing a perioperative nursing course, which had me upskilled with being able to do anaesthetics and recovery and scrub scout, which was great.
Yeah.
Then enjoyed that thoroughly. Then the course changed. We then finished with a degree, not just the diploma.
So how many years of studying was all?
So then that was 12 months doing, so it was 3 years of nursing, then 12 months for the perioperative theatre course. And then I went back and then did 6 months to then upskill the nursing training to finish with a degree.
Right, so your degree is in nursing?
So it's a degree of applied science.
Wow.
Yeah, so it's
smart
great.
lady you are, aren't you?
Most you just do your thing. So it was
good. I
feel very
though.
Blessed.
But I think, this is the thing, people, I would say that the general public don't understand that there has been so many years of study and commitment by you to then come and, because now you've opened your own business of injectables, and but to get to that point, you need to know as much as a doctor. No.
Or as much as someone that's a professional in what they're doing. So having a great understanding of the anatomy, because that's what we're doing. So as I've said, so it paralyses, stops, freezes the muscle, having an understanding of the underlying structures, in particular where the arteries sit, the nerve endings and the veins, so to decrease the risk of a complication.
Yeah, it's a very, it's a very serious undertaking, really, isn't it?
Yeah. It's also challenging and enjoyable because there is so much to learn. So where I've been asked to upskill nurses and mentor them, and whilst they found it so stressful that it wasn't quite clear cut as to how the procedures went and the risks with so much that can go wrong, so whilst it's quite unnerving, it's also exciting too, that there is so much to learn.
Yeah. And do you find that the technology, the procedures, the medicine behind it is changing a lot? Because I see you often post on your socials that you've gone to do another conference in such and such and learning more. So I would
I'm
imagine
lucky to be. Yes. Sorry, I don't want to cut you off.
No, well, I just think that there's so many. You don't just sit back and go, I know all I need to know about that, because there are so many new treatments for a start that you have to be across.
Because treatments are more so techniques as well, which is nice when you can be trained and be with someone that's doing a new procedure, so a new way and a different entry point to make the procedure more safe, or whether even through observing what they do, whether it confirms what I'm doing, that I'm at the level I should be at, or that they may just describe something different, the way they're explaining it to us, which then makes me more upskilled, that I can impart that knowledge onto a client to explain what the procedure is. So there's always something to learn.
Yeah, I think that is, and I think the fact that you actually, I sort of find myself now thinking, I can't possibly learn any more. Well, no, sorry, not in a way that I know everything, but it's as you get older, we have to change with the times, and we have to think about things differently. But actually studying is a whole different thing. The way I learn is quite different. How do you find having to study again? You probably love it.
Yeah, so I do love it. I love being invited. I love the networking side of things, that I love, and I'm the first one there. It almost becomes the Malinda show with me interjecting, asking questions. But it was difficult last year with COVID, that changed most people's lives, and probably for the better for most people. But for last year, doing so many Zoom conferences where you weren't with somebody else, so towards the end I was struggling to be able to pay attention and be enthusiastic about watching something through a screen when they were so far away.
Yeah.
So,
well, this is the thing, and the theme through this show, How Fabulous, as well, and most of the guests I get in, is all about connection, and that it is really important that humans, we connect, and so that's why I think in a different way, the different guests connect with the people that they do whatever they do is in their career or family or whatever, because connection is so important. And what you do, when someone walks into your room, if you're having a terrible day, you won't let that come through, because we're in your hands and we're lying down and you've got a needle hanging over our face. But so you always bring this great energy. You connect with them. You have to connect with someone as soon as they walk through the door, whether it's a new patient and they're starting, they're feeling afraid about something, and I guess any of your other patients. So you need to be on point, I guess, every time with that connection.
30 years of nursing. So that's where when you stop and reflect on it, what is it? What's the consultation process? Is there a flow chart? And when I worked for Laser Clinics Australia, and I was sat on their board representing Victoria, so they used to fly us to Sydney once every 3 months, and so they had someone from each state, and then they found out there was no flow chart. No one internationally had done a process of meeting somebody and working out how to do a thorough consultation from go to woe.
Really? That's incredible, isn't it?
So we had a board in the boardroom. This is the board table. There was at least 15 people seated, and they brought in a team of experts that do marketing, and they had a whiteboard and they were scribbling away, picking our brains, which was great.
And then they came up with this process.
With a flow chart that they were going to then implement So botox were running it, so they wanted a flow chart to then learn from us and our experience, and then be able to then create some sort of a tool that they could then give to less experienced injectors to know that when you meet someone for the first time and not knowing the person, and then building a relationship to then educate them, have them feel comfortable and explain what the outcome could be, and then do the procedure. Yeah. So it seems easy, but then when you start to break it down, the better someone is at a job, the easier it looks. But then when you break it down, what do you do next? When do you take a photograph of someone? How to explain cost and give them an informed financial consent? At what stage do you do that? Explain what the procedure entails, ensuring they're comfortable, explain the aftercare. So there's quite a lot involved when you start to break it down.
And that's the thing, you know, I mean, I think a lot of women think, you know, they're apprehensive about doing something like that anyway, because, you know, as women anywhere, we're often judged about what we look like, what we do for work, what we don't do for work, how long we work, how long we don't work, you know, what we wear, how our faces, how our hair is. So, you know, just making that choice to actually go and see someone, whether it is to get a facial or get their hair dyed or you know, their legs waxed or not waxed, or, you know, is always a big thing, because you're judged if you do, you're judged if you don't.
True.
And I think for me, doing you know, personal styling, for example, I always say to my clients, you know, do you. Do you. So if that means that you want to be wearing makeup, great. If that means that you don't want to be wearing makeup, great. That means you want a hairstyle that is more low maintenance, or whether you want to be doing something, great. If you want to be wearing that kind of clothes, great. If you don't want to be doing it, great. Because it is all about you and dressing for yourself. And I am really firm on that idea that you should do what makes you happy. And would you
No, I agree
say
with
that?
you, and I often say, when you feel good, you look great, and when you look great, you feel great. So it's almost that chicken and the egg, which comes first.
Yeah.
Which is wonderful. So if you feel good,
And it is. It's a very personal thing. And you know, if you do something to make yourself, your looks feel better, or your wardrobe, or your health, you know, health is, I mean, as we get older, of course, health is just like right up there, so much more than,
because without that you don't have anything.
well, exactly. And we've got, you know, I'm sure we've both got friends now and colleagues and, you know, old people in our lives. We're at that point where a lot of, you know, there's a lot of that sort of stuff going on. It's not about how you look, it's about how healthy you are, you know, and people are getting diseases and struggling with all that sort of stuff. So, you know, what you thought was quite important before, and we talked about that, you know, looks only take you so far. It's about what else is going on. But I think it really does have to come back to what you love. And if you feel comfortable talking about it, doing it, wanting to do it, nobody else should judge you on doing that.
I agree. But I believe my philosophy, if I was to have one, it would be less is more.
Yeah.
So dipping your toe in the water, doing what you feel comfortable with, which is what you're saying, having whatever, understanding who you are.
Yeah.
So if you need a little bit of enhancement, that's fine. But less is more.
Yeah.
And just do what concerns you.
Exactly. And then doing it in a way that you know, you feel comfortable with. And usually it's sort of word of mouth, isn't it? You know, it's like, someone will say, oh, have you heard that in the thing? And I know this great lady, and and it sort of spreads that way. And so what do you think that you'll be doing in kind of 10 years then? Do you think you'll still be administering?
So I still work with some plastic surgeons about one day or one evening after hours, one evening a fortnight or so. So I've still got a foot in the door with regards to theatre, nursing, etc. And that's the clinic where I was the director of nursing. So a lot of that's because I love patients, love caring for people. The team of nurses that I've worked with, I'm reluctant to say goodbye to them and not do that. So there's that up my sleeve, but that's only a little sideline. So that's one evening, a fortnight, etc. So COVID came and my life changed, where I used to work at one stage, it was, I don't know, 70 hours, 80 hours I once counted in a week that I did.
Wow,
And I just
how
thought,
did you manage that?
I don't know, the same as all women do. You just do what you do.
Because you've got a family and...
Yeah, I've got 2 fabulous children, 2 boys.
Oh.
But you just put one foot in front of the other. My family helps, and neighbours and friends help if need be. And you just do what you've got to do. You sort of sleep less, basically.
Yeah.
And then COVID happened and decided to only work for myself. So I said goodbye to everything else. And then assumed I wouldn't be very busy. So I'd have this fabulous life with a little bit of work balance. But that didn't quite happen. So, which is great.
And that's because you're so fabulous.
Oh, that's so kind of you to say so. Thank you. As are you. So then have this. Now I've got this nice work-life balance, which is beautiful.
That's great.
I've got a fabulous clinic that I love working from, which is very controlled. Lots of natural light, lots of space. It's beautifully cleaned. It's fabulously stocked. The music's nice, so everything's very nice about it.
It's very you, isn't it?
Yes,
Yeah,
I
it's
think
very
so.
you. So
Reflects
you
me,
walk in
yeah.
and it smells good and it feels good and it looks good and it's very calm. So it's not in no way, it's in no way clinical.
No, I didn't want
feeling.
it sterile.
Yeah.
So it should feel clean, but also comfortable, that you can have a good...
And the sirens going outside.
They might need a nurse.
Quickly! That
So-
reminds me. Yeah, sorry. That
all
reminds me
good.
of a story when I had a car crash once, and it was with a truck, a car and a truck. I was fine. The car was right off, but weirdly, these 2 women in the car in front of us stopped, and they were both nurses.
Wow.
So they helped me. So there you
That's
go.
heroes.
I know, it was
Heroes.
heroes, and I was so out of it. I didn't understand what was going on, but I found out later that they were nurses, and they helped me. I know, amazing, amazing people, nurses, amazing.
So what was I saying? Oh, 10 years' time. So in 10 years' time, a dream, I think, without vocalising it pre-COVID, not really understanding what was going to happen, then COVID hits. I assume I'll do what I'm doing now because I love it.
Yeah.
Most of my referrals are word of mouth, and some of it's through social media and previous clients that are keen to still see me. So I feel very blessed. It's beautiful.
Yeah, and that's not an accident though. I mean, you're not going to go back to somebody that's doing something so intimate and personal without thinking they're really good at what they do. So
I
if you
love
weren't,
what I do.
yeah, well, then that shows. You know, if you weren't, then you know you wouldn't have any clients, would you?
No,
It would be
I spend more
that.
time gardening.
Well,
which is what I
exactly.
thought I'd be doing, but somehow, no, I'm very busy and I feel very blessed every day. Very grateful, very blessed.
Yeah, yeah, that's fantastic.
Yeah.
Well, thank you. Actually, I wanted to ask you one more thing actually before we go. So,
Yeah.
how does Botox work to stop migraines and headaches, or is that a fallacy? Clear
No,
that
that's
one
true.
up for
It can
us.
happen, but I'm not, and I say to all my patients, I'm not a dentist, so I don't treat, which isn't what you've asked, I don't treat people that have got dental issues, nor do I treat people that have migraines, because that requires a medical person that's a dentist or a neurologist. But by default, sometimes, depending on which muscles are working and are engaging, through having Botox, it can ease your jaw, which is called facial slimming. So it's your masseter. If they're injected, you'll wear your teeth less and potentially crack your teeth less. And then similarly then for migraines, treating the frown area and the forehead can assist with the migraine, but I'm not trained to treat migraines. And a true neurologist will inject the back of the head as well, the muscle area through there, and inject through your hairline, which I'm not trained to do.
Oh my gosh. Yeah, that's like
So it's
I go to an
great.
osteo as well, and there's a couple of different osteos at the clinic, and if I've got a really bad if I'm sort of clenching my jaw too much, or this muscle's something and it all sort of is interrelated.
Yeah.
One of them can actually treat me through my mouth. So they put their hands in my mouth and they sort of pinch this thing down here, and they'll put dry needling. They'll do dry needling up through my jaw, but the other one can't do that. So there must be a certain amount, or you'd imagine a certain amount of training that has to happen in order to be able to do all of
specialised
those. Yeah,
treatment.
it's specialised, isn't it? It's fascinating stuff.
Yeah, it's great.
Thank you for coming in today.
Thank you for asking and inviting me.
Continuing to be fabulous and providing fabulous services, and sharing a little bit about your life and how you got
thank you.
there. Love it.
Thank you very much.
Thanks, Malinda.